So, you know, from our angle, we really want to do stuff that's non-invasive. So we're going to chronicle this situation for you, kind of show you, you know, how you can progress with zero invasive measures. Dr. Chris here, and this is Dr. Angelique here. Just wanted to show you that I'm human too, and do stupid things sometimes, just like all of you as patients out there. So we're doing a ton of renovations at my house. Luckily, Dr. Angelique's here doing a house call today working on me, but we wanted to show you kind of how this started. I took the bottom piece off this chandelier, thank goodness. We're in the process, I'm about to hit myself again. And doing renovations, took this bottom piece off, and then I set something down on the ground. My wife's behind me and says, "Watch out!" And as soon as I picked my head up, the top of my head hit here as I was coming up. It hit so hard that it actually was bleeding, was on the ground for a while here, and it was not a good thing at all. So as the week went on, this is Saturday today, this happened this past Sunday. As this week's gone on, about midweek, 3 days after it, I lost complete strength in my deltoid and can't raise my arm. And so right now, if you want to take a look at this is about where I am, right here. And you can see this is nothing, just raising the arm up. A week before, I was lifting really heavy dumbbells and everything else, so this is not normal for me. But
right. This is prime example of you've heard us talk about it in the office of brain shock. So bonk on the head, and then turns off a bunch of nerves here in the neck, going down into the arm, affecting some of his cranial nerves. So concussions, remember, are not just sports related. They can happen in everyday life renovations at your house. So just be aware, right? You know these things that can happen. If something happens to you, remember to get it checked immediately. If it's an emergency situation, and then come into the office and we'll get your nerves checked out and turned back on. So luckily, Dr. Carmi has us on staff to be here for him in the office during the day, and then making those Saturday house calls.
we've also had, just to give credit, Dr. Ed Chauvin has been working on me as well. He's one of our docs in Louisiana. Remember, we have 5 of us here in the state of Louisiana, 3 of them in our office. Dr. Ed's in Abbeville, does this technique as well for nerve rehabilitation. So, you know, the average person who has something like this ends up going to the emergency room, ends up going to a surgeon, having MRIs, injections, a lot of invasive stuff. And so, you know, from our angle, we really want to do stuff that's non-invasive. So we're going to chronicle this situation for you, kind of show you, you know, how you can progress with zero invasive measures. And so that's the goal, is to try to go through life and need medicine the least amount as possible, need injections the least amount as possible, and need surgery the least amount as possible. So I guess that's it.
Stay tuned, and we'll keep you updated on Doc's progress.